In this lecture, we begin with a general introduction to the profession of clinical exercise physiology. And this lecture and this unit will be based largely upon the first chapter of the course textbook by Ehrman et al. Clinical exercise physiology is just simply the study of and practice of exercise physiology related to various clinical based conditions. And this discipline first of all, addresses the relationship between exercise and chronic disease, and necessitates an understanding of the physiological mechanisms and various physiological adaptations that occur with exercise and how those adaptations can influence the disease process. One critical aspect of clinical exercise physiology is the practice of testing and prescription of exercise. And there are four general elements to exercise testing and prescription. The first is evaluation. Before any sort of exercise prescription can be made, an understanding of the patient or client's physical capabilities must be established, as well as examining other various health markers that are often assessed under resting and or fasting conditions. All of that information that is gathered will eventually lead to a diagnosis of a particular condition. And when we talk about the diagnosis will follow the evaluation in terms of identifying the specific disease or disorder that is afflicting a person. Exercise testing and prescription will also address the prevention of developing or the further worsening of a person's particular disorder or disease. And this is often addressed in part by examining health behaviors as well as other sorts of medical interventions. And in terms of treatment, the treatment goal is to mitigate, which is to decrease pathology progression, as well as contributing to an increase in the recovery with the overall goal of enhancing the functionality of the patient or the client. This slide here will address something that's not covered in Chapter 1, but the physical activity continuum is a good approach to examining the various range of different levels of physical activity. And we begin at the very lowest level, which is sedentary physical behavior. Whereas this little cartoon illustrates that a person sedentary will only engage in physical movement or physical activity that is absolutely necessary. As we increase our level of physical activity, some people will have a higher level that is required from daily activity as part of other daily activities, which include various occupational tasks. Stepping up further in terms of the activity continuum, lifestyle daily activity refers to that activity that extends what is just simply required for occupational or necessary reasons. And further elevating that lifestyle daily activity is what I call irregular exercise. So individuals that may not be engaged in quote unquote exercise tasks in a regular manner, but will engage in various sports related tasks with friends in a discontinuous or inconsistent manner. Now, engaging in regular mild exercise elevates from lifestyle daily activity and irregular so that a person is engaging in a heightened level of activity on a regular and more consistent level. Now, we know many people will take that regular exercise and elevate the volume and the intensity of that exercise into what many will describe as just simply working out. Uh, as we move to a more formal level of physical activity with competitive sports, a much more focused and further elevation in exercise volume and intensity takes place that we just simply would refer to as training. Now, many individuals would engage in training even though they may not be actively participating in some organized sport. And the physical activity continuum can further increase. And this is where we potentially could result in an overtraining syndrome where a person would begin to experience a reduction in physical capabilities by training too much. And so the overall message of this slide is to examine and understand physical activity as a full continuum that is part of a person's life and daily routine that breaks away from the traditional or a typical understanding of either a person is active or they are not active. But what is important to understand from a clinical exercise physiology perspective is not whether a person is active, but to what degree is that person active. So before we move on, to understand physiology is to understand that physiology is the science of the mechanisms of how living organisms and components function in terms of chemical and physical processes. And so before we move any further with physiology, if we think about human anatomy is defined as the structure and function of various organisms and the human organism. Physiology is how the organism carries out the unique function. This quotation is taken from a classic textbook on medical physiology by Guyton and Hall. Now, this definition is certainly not to be memorized, but it's good to go read through. Please read through this definition as it provides an overall understanding of what physiology is all about. And we will certainly address different elements of this quotation from Guyton and Hall. Now, moving back to exercise physiology from a clinical perspective, what we see here is that the breadth or the amount of the knowledge base is actually quite expansive. And this starts with an understanding of basic structure and function. So with exercise physiology, education, and preparation, cadaver laboratory prosection examinations are often helpful, but due to cost and resources, not all anatomy courses would necessarily have access to human cadaver labs. However, anatomy is certainly the foundation for clinical exercise physiology. Now, once that basic understanding is established, the clinical exercise physiology profession will then move on, or education track will move on to the study of basic human physiology, which is the mechanism, which relates to the mechanisms of human function. And this relates to the overall organism, organ systems, cellular mechanisms, molecular mechanisms, as well as how those different mechanisms operate under conditions of exercise. The study of chemistry is often helpful when examining the physiological processes, particularly at the cellular and molecular level, whether that includes both organic and biochemistry, although the study of clinical exercise physiology does not always necessitate coursework specifically in organic chemistry or biochemistry, but those are often topics are often examined in the study of physiology. And this is all brought together in the study of kinesiology, which is a study of human movement that incorporates a wide range of topics that not just includes movement patterns, but also examines biomechanics and applied or exercise physiology. And we can't discount the effects of the psychological factors that influence a patient or client's motivations to engage in physical activity. And this includes elements of behavioral medicine, counseling, and as well as coaching. The clinical exercise physiologist has a number of various duties as part of that occupation. And before any sort of exercise testing or prescription is carried out, it is important to first assess the risk of exercise testing to begin with by understanding the patient or client's physical capabilities and or health capabilities. And that is first carried out by analyzing whatever medical records or other types of tests may be available. And once the risk and capabilities are evaluated, then that allows the clinical exercise physiologist to begin assembling the best and most effective exercise regimen. The next step is to actually administer fitness and or stress tests if indicated. And as part of the assessment, the clinical exercise physiologist is trained to obtain various measures, which include, but not limited to, blood pressure, oxygen usage. Now, oxygen usage does require some technology in terms of oxygen sensors and what are called metabolic carts. But the clinical exercise physiologist is trained in being able to use that sort of technology, as well as evaluating cardiovascular function. At the simplest level is to examine patterns or changes in heart rate with different levels of activity, and in a more detailed manner is to examine the electrical pattern emanating from the heart captured in what's called the electrocardiogram, or just simply the ECG. And once all of this information is gathered, the clinical exercise physiologist will then be able to develop an effective and very specific exercise program that is directed to the individual patient and or client. In terms of the services offered by clinical exercise physiologists, this has the overarching aim of improving the physical capabilities of the patient or client. And this includes counseling on chronic disease management. And so some individuals, if they're afflicted with diabetes mellitus or high blood pressure, the clinical exercise physiologist will be able to provide that level of exercise prescription so that individuals will be able to better manage conditions such as these two. The improvement of physical capability will also help to reduce the risk of development or either the early development or further exacerbation of various chronic diseases. And one such example is cardiovascular disease. This all aims to work by creating what are called lifestyle habits, or also referred to as developing positive health behaviors. And these positive health behaviors involve two main elements in practicing healthy nutrition as well as engaging in healthy physical activity. And the ability to do the first three bullet items will involve understanding and mitigating or even eliminating barriers that a patient or client may have to making those incorporating those healthy lifestyle changes. In doing so, carrying out daily activities will be improved, and those daily activities will be able to be carried out with relatively less effort. And in doing so, this will increase the likelihood of longer term physical independence on the part of the patient or the client. Some general work settings for the clinical exercise physiologist include hospitals, outpatient clinics, and so the outpatient clinic is where a patient that has undergone perhaps some surgical intervention or is under the care of a physician, but is not staying overnight in the hospital, but is routinely coming in either for exercise testing and prescription or the initial testing and repeated testing. Physician offices will often employ clinical exercise physiologists, and university and hospital-based research facilities will very much necessitate the involvement of clinical exercise physiologists. So this ends the first part of our Unit 1 lecture.